In this video, I'm going to be telling you how to fix drooping hooded upper eyelids. There are 3 things you have to know before you consider this type of procedure. And the surprising thing is that the problem might not lie in your eyelid at all. There are a lot of fancy terms for this surgery, but I'm going to make it simple. I'm a board-certified eye surgeon specializing exclusively in eyelid surgery. You'll want to stay to the end because I'll be giving a bonus tip on how to pick your surgeon if you're considering this type of procedure. 99% of people who come into my office think it's just the extra skin on the upper eyelid that's causing the hooding, but this is a total misconception. In actuality, the problem is often more than one thing, and in this video I'll explain why. The common thread for why people come into my office to get this kind of thing fixed is they say, I don't feel that tired, but I look really tired. Or when I look at photos, my eyes look really small. Or they say, when I pull my eyelids like this, I can just see so much better. If those are things you've noticed, then keep watching because I have lots of tips for you. So here's what you're going to learn in this video. First, I'm going to tell you the 3 real causes of drooping upper eyelids, and I'm also going to tell you how you can diagnose yourself by looking in the mirror to see if you have one of these signs. The second thing is I'll tell you the solution for each problem, and then a bonus tip at the end on how to pick your surgeon. Let's get into this. Okay, before we dive into the 3 causes, let's get just a quick foundation on the anatomy. Let's think of your eyelid like a window shade with a curtain rod at the top. The way that your eyelid looks and functions depends on 3 things working together perfectly. First, you have the eyebrow. The eyebrow is like the mounting bracket or the curtain rod at the top of everything. It frames the whole window and frames your eyelid. If your eyebrows are tilted down at the sides, it's going to affect how all the fabric sits underneath it if the bar is bent. So it doesn't matter if you trim the fabric from below like having an eyelid surgery if the eyebrow itself is the problem. The eyebrow frames this whole area. Second, there's the eyelid skin itself. This is the fabric of the curtain. And the skin on our eyelids is the thinnest in our body. The skin can thin out even further with aging, sun exposure, or rubbing your eyes, which you should definitely not do because it can make this problem worse. The skin is supposed to drape smoothly and form a nice fold above our natural eyelid crease. Some people don't have a fold like myself, but most people have some sort of fold to the upper eyelid skin that causes that hooding there that can increasingly become worse over time. The third part of the anatomy, hidden underneath, is the pulley system that makes the window shade open and shut. This is a tiny but powerful muscle called the levator muscle. When your brain tells your eyes to open, this muscle tightens or contracts. When it tightens or contracts, it pulls the eyelid up the same way that a pulley would do on a window shade where it pulls that wooden bar up from the bottom to open up the window. So the look of your eyelid depends on 3 things: having a straight curtain rod, having the right amount of fabric below it, and having a working pulley system so that when your brain wants to open your eyes, it doesn't have to pull extra hard to open it. When any one of these parts has a problem, the whole system looks off and you can get that hooded, sleepy appearance. So now that we understand the anatomy, let's look at these 3 causes and how you can diagnose it on yourself. All right, the first cause, the one that most people overlook, is not even on the eyelid itself. It's the eyebrow muscle up here. When the curtain rod or the eyebrow starts to sag, the term for that medically is called brow ptosis. As we get older and as we squint over time, the gravity kind of pulls this outer part of the eyebrow where we don't really have a rescue muscle out here. It pulls it down over time. It wins that tug of war so that that eyebrow kind of hangs below the bone there. When the curtain rod is bent at the sides, it causes all that fabric to kind of lay on the floor no matter how much fabric you have below it. This is going to create that hooded appearance where your eyes feel kind of crowded or heavy, especially out in the outer corners by your temples. Here's the classic sign of brow ptosis. Take your finger and run it across your eyebrow hairs to see where it sits. Normally, it should stay on top of that forehead bone as you go across, especially as you cross the outer half. If you have brow ptosis, when you go across, as you get to the outer half, it kind of dips below the bone, and you kind of feel how those eyebrow hairs are sitting below the bone. The key thing with this is you have to have your forehead relaxed when you're doing this, because obviously if you're doing this as you're doing that test, it's always going to be sitting on the bone. If your forehead is relaxed, so you're not using any extra muscles to lift your eyelids open, and the eyebrow is going below the bone, then you might have something called brow ptosis. The second cause is what most people think of when they think of droopy eyelids. It's that extra skin that kind of bunches up and gathers together and folds over the eyelashes. The medical term for this is dermatochalasis. So if cause number 1 was a sagging curtain rod, cause number 2 is having too much fabric because it's just stretched out, so the fabric is what's causing everything to kind of lay on the floor. With eye rubbing, sun exposure, and genetics, that thin skin on the upper eyelid can stretch out because it doesn't have the appropriate amount of collagen and elastin to keep that form, to keep it off of the eyelashes. What this looks like with the eyelids is that skin starts to go over that natural crease, sit on top of your eyelashes, which can make wearing makeup difficult if that's something that you do, or even in some cases it can overhang the eyelashes and block the colored part of your eye above your pupil, which is the black dot in the center of your eye. If this curtain starts to block your vision, it's like wearing a baseball cap pulled way down too low. It's gonna block your view of what's going on up here. You might find yourself physically lifting your fingers to see, or worse, you're using your forehead to kind of pull all that heavy, redundant extra skin up to get it off of your eyelashes so you can see better. What that's gonna do is it's gonna lead to strain of your eyebrow, possibly headaches, and then horizontal wrinkles will form in the center of your forehead because you're just doing that all the time. So if you see the wrinkles on your forehead, it might be because you have one of these issues, like problem number 2 or problem with the pulley of the eyelid that's causing you to use your forehead to be able to see. So here's the sign to see if you have dermatochalasis that you can test on yourself. So close your eyes and pull that redundant skin. And if your eyelid cracks open like mine's doing, then you probably don't have a lot of extra skin. However, if you pull and pull and pull and you can pull a bunch of redundant skin without your eye opening, well, you might have more skin than you need on your upper eyelids to safely close your eyes, and therefore something like an upper blepharoplasty surgery, which is removing some of that extra skin, could help in terms of aesthetics and in terms of your vision if you have too much extra skin. The third cause of hooded upper eyelids is something called ptosis, which is completely different from the other two. This isn't a problem with the curtain rod or with the fabric, it's a problem with the pulley cord that helps to lift your eyes open when your brain tells it to. Ptosis is what happens when that pulley mechanism that lifts the eyelid up stretches out, so the brain has to work extra hard by using your forehead muscle to be able to open your eyes. The most common cause in adults is wear and tear. Sometimes rubbing of the eyes or wearing contact lenses or having previous eye surgery can contribute to developing ptosis. But most of the time we don't really figure out why it happens. So if you think of it like that cord analogy with the window shade, if the actual cord has frayed or stretched, and your brain is working extra hard to pull it, even using your forehead, it's gonna be stretched out so that the eyelids are sitting kind of low. This has nothing to do with extra skin. The key to understanding this is the position of something called the eyelid margin. So what is the eyelid margin? The eyelid margin is the position of your eyelid where the eyelashes come out. So it's that border of your eyelid. Normally, the eyelid margin has a nice arch shape to it, and at the very center point, the eyelid margin should be about 4 or 5 millimeters above the center of the black dot in your eye, the pupil. In other words, in a normal situation, you want to be able to see a little bit of the colored part of the eye, whether your eyes are brown or blue, just above that black dot in the center without you having to drag your forehead open to see it. If you notice that the eyelid margin, so where those eyelashes come out, has more of a flat shape as opposed to an arch shape, or if it's covering up some of the blue or brown part of your eye, or even if it's covering up the pupil, the black dot, that could mean that you have something called ptosis, where the attachment of that tendon to the eyelid is not very good. It's kind of stretched out, so you have to work extra hard just to lift the eyelid open, and the eyelid sits too low. A lot of celebrities have this problem. Think of like Forrest Whitaker or Michelle Obama or Paris Hilton. It's a very common problem. And when you have ptosis, the compensation that your body makes is you either use your forehead, or some people even adopt a chin-up posture so they can kind of see better down below, which can irritate your neck muscles and give you headaches. The way to tell if you have ptosis is to look in the mirror, relax your forehead again, and try to see where that eyelid margin sits relative to the center of your eye. Sometimes taking a picture can be helpful to kind of determine this, or having somebody else take a picture with you just relaxing your forehead and not making any lines in your forehead. When you look at the picture, is the eyelid margin making a nice arch over your pupil to where you can see a little bit of the colored part of your eye? Or Is the eyelid margin sitting a little flat to where it's covering that colored part of your eye or covering the black dot, the pupil? If so, then you probably have something called ptosis. So to be crystal clear, there's 3 causes to hooded upper eyelids: the brow, the skin, and the eyelid muscle. The kicker is that a lot of people have a problem with more than one of these things, which is why it's so important to see an expert when you're trying to get this fixed. So if you're looking in the mirror and any of this sounds familiar, then the next step is to get a professional evaluation. This is important because the treatment for each one is completely different, and I'm going to go over that now. For example, if your eyebrows are sagging on the outer half of the eyebrow hairs, then you might need something called a forehead lift or a brow lift to kind of reset that area and straighten out the curtain rod before you work on the fabric below. This is really key. If you have an eyebrow problem, but you go and see a doctor who's not experienced with this kind of stuff, and all they do is they remove skin, well, if your eyebrow has a lot of slack in it, removing skin is just going to pull that eyebrow down even further, because when we suture it back up, it pulls things down. So it's super important that if you have an eyebrow problem, you get that straightened out in addition to fixing the fabric, not just going after the fabric or the skin itself. For extra redundant upper eyelid skin, a surgeon can remove a safe amount of that skin so you can still close your eyes, and that's something called an upper eyelid blepharoplasty. It's the most common eyelid surgery that I do. If you have true ptosis of the upper eyelid, where that eyelid margin is more flat and doesn't have that nice arch shape, then you need a surgeon to reattach that muscle safely so that your brain can tell your eyes to open and they can look more awake and alert without that kind of heavy squinting look. Here's what a good consultation should look like. A surgeon will do an exam, take pictures, measure your eyelid and where they are relative to the pupil, and kind of test to see if your brows are the problem or if the eyelids are the problem. This consultation is an opportunity for you to discuss what bothers you, whether that's functionally, like you can't see very well, or aesthetically, you just don't like what you're seeing in the mirror. The goal is to get a good diagnosis to establish the true cause, or sometimes causes if there's more than one, so that you can get a personalized treatment plan for your specific anatomy. If the doctor doesn't look at all 3 of these possible causes, they might be offering you a solution before really diagnosing the problem in the first place. So to recap, that feeling of a heavy hooded upper eyelid can be related to 3 things: the eyebrow, or in our example, the curtain rod, the extra upper eyelid skin, which in our example is the fabric of the curtain, or ptosis, or the eyelid margin being too low, which in that case would be the pulley of that window shade being stretched out or frayed so that the bar of the window shade doesn't come up high enough for you to be able to see well. The key takeaway is that droopy eyelids are more complex than they might seem at first. It's not just skin. Get a proper diagnosis from a qualified specialist so you can get a great outcome both from a functional and an aesthetic standpoint. Okay, now here's the bonus tip. How do you pick a surgeon when you are considering an eyelid procedure? In my experience, the most important thing is to find a surgeon who does lots and lots and lots of eyelid procedures. My specialty is something called oculofacial plastic surgery or oculoplastic surgery, and my whole practice is exclusively performing eyelid surgery. To find an oculofacial specialist near you, our professional society is called oculofacialsociety.org. The other specialties that commonly perform this procedure are facial plastic ENT surgeons and comprehensive plastic surgeons. Some of those surgeons do a high volume of eyelid surgery, and you would see that by their social media posts, their before and after gallery, and just showing you examples of the different types of problems they've corrected from the ones that we just discussed. If you go to a surgeon who does mostly nasal surgery or mostly body surgery, but not a lot of eyelid surgery, even though they are one of those specialties, then you might just want to see how the consultation goes to kind of figure out if they seem qualified to evaluate all these 3 things before pursuing a procedure. Most important thing, in addition to finding a qualified surgeon, is to having a good comfort level with that surgeon so that you can trust them through the process. Because if something goes wrong, you're going to want to have a good relationship starting point to work from instead of having a bad feeling from the get-go. Hopefully this video will understand what they should be looking for when they're evaluating your upper eyelids. I really hope this explanation helps demystify why upper eyelids can droop. It's really 3 possibilities. If you found this video informative, please give us a thumbs up or hit the subscribe button below to get more expert explanations for plastic surgery. And if you have any questions, please leave them in the comments below. I do read them. But you know the drill. For a personal diagnosis, you need to see a specialist in person to figure out what you've got going on. Thanks for watching.